Okay, so let's talk about arterial blood gases because this is where we get the information about pH, CO2, bicarbonate, all the all the values that we need to determine whether someone has a normal pH or a respiratory acidosis or a metabolic acidosis or any of the other ones. Okay, so an arterial blood gas is typically obtained from the radial artery. So we put a needle into the radial artery and we obtain an arterial blood gas. And the blood that we obtain in that needle needs to be immediately processed before those values change. So we take that syringe that we just obtained the blood in and we take it right to the laboratory and process it to get the values right away. Otherwise, they all start to change in the blood. Okay. Okay, so what are normal values of an arterial blood gas? Well, your pH between 7.35 and 7.45. Your pCO2 is between 35 and 45. Your bicarbonate levels between 22 and 26. Your PaO2, which is the pressure of oxygen in your blood, in your serum, is between 80 and 100. Okay, that's not your oxygen saturation. That's the partial pressure of oxygen in your bloodstream. Just like PaCO2 is the partial pressure of CO2 in your bloodstream. Your SaO2 is the same as your O2 saturation, which is that monitor that we put on the end of your finger. You can see in the first picture there. And that's measuring the saturation of hemoglobin with oxygen. So your oxygen saturation. Okay? So these are your typical values. And let's go on and do some examples. Okay? And by knowing your normal values, you'll be able to work on whether someone has a respiratory condition or a metabolic condition that's causing their changes in the pH. Okay, so let's just solidify the information more before we get to some cases here. So your arterial blood gas component, okay, pH, 7.35 to 7.45. Typically, as you get towards 6.8, 6.9, that's pretty severe acidosis. A lot of patients will have a cardiac arrest and they'll be severely hyperkalemic. Okay, so acidosis less than 7.35, alkalosis greater than 7.45. And what terms do we use? Well, acidosis, alkalosis, or a normal pH. Okay. Normal range of PaCO2, your carbon dioxide that's dissolved in your bloodstream, 35 to 45 millimeters of mercury. If it's beyond 45, it's high. Okay, we'll just say high for a PaCO2. And if you have a high PaCO2, it's usually from a respiratory condition. Alkalosis, a low PaCO2, lower than 35, so it's being blown off too much. That's usually because the patient is breathing too fast, or the machine that they're attached to, the mechanical ventilator, is breathing too fast for them. The setting is too high. Okay, so typically when you're looking at your CO2, if it's abnormal, it's going to be a respiratory problem. If it's too high, it's going to result in a respiratory acidosis. If it's too low, it's going to result in a respiratory alkalosis. Okay, what about bicarbonate? Well, that's one of your buffering systems, right? That's made by the kidneys. Normal range 22 to 26 in the bloodstream. If it's too low, it's because the acids in your bloodstream are consuming some of it to try and buffer the acidosis. So a low bicarbonate is telling you that the acids have been consuming your bicarbonate. If it's too high, it's telling you that you probably have low acid in you're probably alkalotic because you have too much bicarbonate. So the acids, the H plus, haven't been consuming it at all. Okay, so we look at bicarbonate levels more so in a metabolic acidosis or an alkalosis. We look at CO2, trying to determine if someone has a respiratory acidosis or alkalosis. Okay, so let's look at some steps to interpret an arterial blood gas. So the first one is, what is the pH? So if the pH is between 7.35 and 7.45, you don't have an issue, right? There's no acidosis, there's no alkalosis. It's normal, okay? So then let's look at the CO2, okay? So if you have an acidosis and you have an elevated CO2, that's telling you that you likely have a respiratory acidosis because you've been unable to clear your CO2, okay? Then let's look at the bicarbonate. And is it low or high? If it's low, it's telling you that the acid in your bloodstream, the hydrogen ions, have been consuming some of the bicarbonate to buffer the acidosis. Okay, so we're going to look at pH, CO2, and bicarbonate, and then we'll determine what kind of a condition the patients have. Okay, and lastly, if they're all normal, are they all normal? And if they are, then the patient may be what's called fully compensated, right? So, and we'll talk about that. So what does compensation mean? So say somebody had a metabolic acidosis and the body has been able to compensate by breathing faster, by providing more bicarbonate from the kidneys, and the pH has been able to return to normal. Well, that's compensation, right? The pH is normal. So that's full compensation. What's partial compensation? It's where the values of the CO2 and the bicarbonate have changed, and the pH is improving as we do a new blood gas, and we follow the pH, but it hasn't returned to normal. So the pH hasn't returned to normal, but it's improving from one blood gas to the next. And we can usually see that by looking at the CO2 that's improving or the bicarbonate that's improving to gradually bring the pH back into the normal range. Okay, so full compensation of an acidosis or an alkalosis means the pH has returned to normal. Partial compensation is the pH hasn't returned to normal yet, but we can see from doing multiple arterial blood gases that it is improving, and it's getting closer and closer to a normal pH. So if we're looking at an ABG, an arterial blood gas, because we're wondering if a patient is acidotic or alkalotic, we look at the values, but we ask ourselves in a certain way so that we can determine what's happening with the acid base. So the first question is, what's the pH? If it's between 7.35 and 7.45, they're not acidotic or alkalotic. That's normal range. So if it's lower than that, it's acidotic. If it's higher than 7.45, it's alkalotic. Okay, what's happening with the CO2 in the blood, in the serum? If it's elevated, higher than 45, it means you're not able to clear the CO2 because of a lung problem. So if you have a high CO2 and a low pH, it's going to be a respiratory acidosis. If you have a low CO2 and a high pH, it's going to be a respiratory alkalosis. So the CO2 can help lead you to whether it's a respiratory condition because it'll be elevated since you're unable to clear it, or if it's very, very low, it means you're blowing it off too fast, and if you see an alkalosis, then it'll be a respiratory alkalosis. So the bicarbonate, number 3, HCO3. So if you have an acidosis, a pH less than 7.35, and your bicarb is low, say it's 16 or 17, then and your CO2 is normal, then you have a metabolic acidosis. You're using the bicarb to buffer the acids that are in your blood. If you have an elevated bicarbonate and your pH is greater than 7.45, you likely have a metabolic alkalosis. So if they all look good and the pH is in a normal value, then you don't have anything. So make sure you know the normal values, because if one of them is off, it's usually leading you to which of the 4 conditions you have. And remember, the acidosis conditions are much, much more common. Now, we call something as compensated acidosis or compensated alkalosis. So if you have a partial compensation, it means that you're still maybe acidotic, so your pH is 7.3, and your bicarb is a bit low, say it's 20, you might have a partial compensation, meaning the body is doing everything it can to get it back to 7.35. Usually you need a number of arterial blood gases to see the improvement in the pH. If the question is about full compensation, like you have a compensated pH imbalance or acid imbalance, then by definition you have to have a normal pH. So you may have had, say, a respiratory acidosis, but if the pH has been normalized by buffering mechanism, then it's a compensated respiratory acidosis. So look at the CO2. If it's elevated, it likely means that you have a respiratory acidosis if the pH is low. If the CO2 is low and the pH is high, that's a respiratory alkalosis, much less common. HCO3 is the buffering system in the body. So if your HCO3 is low in the setting of an acidosis, then you have a metabolic acidosis. If the HCO3 is high and you're alkalotic, meaning your pH is more than 7.45, you have a metabolic alkalosis.
So let's try a few examples here. So, I mean, typically in real life, you have a patient in front of you, and you can see whether they're in respiratory distress or if their symptoms are. Okay, let's do the next one. No patient in front of us, just these lab values on a arterial.
Okay, so let's look at this next one. Now, let's say that this patient initially had a pH of 7.2, and this is the repeat arterial blood gas, okay? Because now we're seeing that the pH is 7.35, so we needed something to compare it to still call it respiratory acidosis that's fully compensated. And the reason why we would say fully compensated is that the pH is within normal limits now. They're not acidotic. But you can see that the PaCO2 is elevated, which is a very strong indicator that the source of the acidosis is respiratory. The bicarbonate is elevated because the kidneys have caught up with producing bicarbonate to neutralize the acids, and that's why the pH has returned to normal. Okay, and the PaCO2 of 70 and the oxygen saturation of 85 is really telling you that this is a respiratory problem. Those are low values. So we can call it a respiratory acidosis that's fully compensated if we had the previous arterial blood gas to see that they were acidotic to begin with. Okay, so if you were to ask me, with this pH of 7.35, are they really acidotic? The answer would be no, they're not acidotic anymore. But if we had serial arterial blood gases, we could say, oh, this person had a respiratory acidosis, which is now fully compensated.
Okay, another one. So always look at the pH first. 7.48. Well, it's more than 7.45, so we're going to call it alkalotic. Okay. So let's look at the next one, the pH of 7.3. We already know we're dealing with an acidosis of some